ZIKA virus disease. ZIKA virus disease is a mosquito-borne viral disease. ZIKA virus is primarily transmitted by the bite of an infected mosquito from the Aedes genes. Aedes mosquitoes usually bite during day, begin during early morning and late afternoon or evening. This is the same mosquito that transmits dengue, chikungunya and yellow fever. 1 out of 5 people may develop symptoms. There are 2 types of Aedes mosquitoes known to be capable of transmitting ZIKA virus. In most cases, ZIKA is spread through the Aedes aegypti mosquito in tropical and subtropical region. The Albopictus mosquitoes can also transmit the virus, can hibernate to survive regions with cooler temperature. The type of vectors, 2 types of vectors, mechanical and biological. Mechanical vectors, cockroach, houseflies, etc. and biological vectors, mosquitoes, flea, T-series, sandflies. Group 4 plus RNA, family Flaviviridae, genes Flavivirus and species is ZIKA. History. The virus was first isolated in 1947 from a rhinus monkeys in the ZIKA forest of Uganda. Scientists conducting routine surveillance for yellow fever in the ZIKA forest of Uganda isolate the ZIKA virus in sample taken from a captive sentinel rhinus monkey. 1947 from first rhinus monkey case is detected. In 1952, first human case detected in Uganda. Then 1969 to 1983, Asia including Indonesia, India, Malaysia and Pakistan. Then 2007, Africa, Asia and Yap Island. This is the first large outbreak in humans. Then 2012, Philippines, 2013 and 2014, South America and Caribbean, 2021, India, Kerala, Trivandrum and Kottayam. Incubation period. The incubation period of ZIKA virus disease is not clear, but is likely to a few days, that is 3 to 14 days. Incubation period and help identify risk periods and local viral transmission. Symptoms. Symptoms mean people infected with ZIKA virus won't have symptoms or will only have mild symptoms. Symptoms lasting for several days to a week. The common symptoms: fever, acute onset of fever and low-grade fever. Then rashes seen in face, trunk, extremities, palms and soles. Headache, joint pain, red eyes or conjunctivitis, muscle pain and malaise. These are the main symptoms we can able to see in case of ZIKA virus. The other symptoms are dizziness, edema of the extremities, retroorbital pain, anorexia, photophobia, gastrointestinal disorders, sore throat, cough, back pain, sweating and lymphadenopathy. Mode of transmission: mosquito bite, maternal to fetal, sexual contact, blood transfusion and organ transplantation. Mosquito bite primarily transmitted the bite of an infected Aedes mosquitoes and Aedes albopictus. The main way ZIKA disease is transmitted from the bite of an infected mosquitoes. Once a mosquito bites a person who is infected with the virus, after about 10 days the mosquito is able to transmit the virus to the other people it's bite. Second one, maternal to fetal. ZIKA virus is transmitted from mother to fetus. Since the virus is present in the blood, there is a risk for congenital transmission from a pregnant woman to her baby during pregnancy. Currently, there are no reports of the infants getting ZIKA virus through breastfeeding. Sexual contact, sexual transmission from an infected person, it is more possible for Zika to be spread through unprotected sexual contact than blood transfusion and organ transplantation. Next, laboratory findings. Laboratory testing can confirm the presence of Zika virus in the blood. History collection. Under the history collection, travel history, contact history and social history, physical examination, blood test, RT-PCR and urine test. Prevention, control and treatment. Prevention, no vaccine yet available. The best way to prevent disease spread by mosquitoes is to protect yourself and your family from mosquito bite. Control, stay indoors with the window and door screens. Use EDA registered insect repels. Wear long-sleeved shirts and long pants. Do not use products containing oil of lemon, eucalyptus or parametandiol on children younger than 3 years old. At home side, stay in places with air conditioning and window and door screens to keep mosquitoes outside. Take steps to control mosquitoes inside and outside your home. Mosquito netting can be used to cover babies younger than 2 months. Sleep under mosquito bed net if air-conditioned or screened room are not available or if sleeping outdoors. Treatment. There is no specific treatment for Zika virus disease, only symptomatic treatment. Supportive therapy. Drink plenty of fluid to prevent dehydration. Get plenty of rest. Take medicines such as acetaminophen to reduce fever and pain. Do not take aspirin or other non-steroidal anti-inflammatory drugs. If you are taking medicine for another medical condition, take to your healthcare provider before taking additional medication. Complications, neurological disorders, Guillain-Barré syndrome and paralysis, congenital brain abnormalities during pregnancy, microcephaly and congenital contractures, example clubfoot.